What questions should I ask if I've been told I need a breast biopsy? Let me share some important thoughts with you about that. You've been recommended to have a breast biopsy. It may be because of a lump that's felt in your breast, the results of your mammograms, your ultrasound examination, or the combination of all three. You should be asking some questions about the proposed breast biopsy. The most important question is, why do I need it, and what type of biopsy will it be? Basically, there are two choices. The first choice, and what I believe is the standard of care choice, is to do a large needle biopsy called a core biopsy. Sometimes the needle can be a fine needle aspirate biopsy, but frankly, we get more information from the core needle biopsy. This is certainly the preferable way of doing a breast biopsy when the diagnosis is not known. Now, occasionally, the biopsy needs to be done as an open surgical biopsy. And usually for diagnosis, that's typically not the case at all. So if it's being done for diagnosis and your surgeon or doctor says, well, gosh, you need an open biopsy in an operating room, you should be asking a lot of questions. As I've just indicated, really the standard of care is to do needle biopsies when at all possible. However, the term excisional breast biopsy is also used when you're going to have a benign lump in the breast, like a fibroadenoma removed. That clearly is an open surgical procedure that's done in the operating room. So when it comes to going to an operating room, you need to ask, gee, doctor, can we do this under local anesthetic, which is a lower risk procedure? Or if we're going to use general anesthetic, are you also going to add local anesthetic so when I wake up, I'll have less pain? You also want to know where the incision is going to be made. You want to know if it's going to deform your breast in any way. You want to know if the surgeon is going to use in an open biopsy a cosmetically appropriate approach. And if the reason that you need the open excisional biopsy is because they can't see or feel the area on physical examination, then what technique of wire localization is going to be used? These are all important questions. These are questions you should be asking before ever proceeding ahead with a breast biopsy of any kind. Be informed, be empowered, ask the right questions.
Hi, I'm Wendy Hartley, co-founder of Breast Cancer Answers. You know, not every breast cancer patient benefits from chemotherapy. When I was diagnosed, my doctor thought I would need chemotherapy. But then I learned about the Oncotype DX test, which helps your doctor decide if chemotherapy could benefit you based on the unique biology of your tumor. My test results revealed I had a very low chance of my cancer returning, which meant I didn't need chemotherapy after all. To learn more about the Oncotype DX test, click this button here.